Hello, my name's Sophia. I'm a student paramedic. I'd like to perform a respiratory assessment on you today, but first off I just need to check you're the patient I'm looking for. Can you please tell me your name and date of birth?
Caitlin Foster, 9th of the 10th, 1995.
Okay, cool. So I'm going to perform a respiratory exam on you today. It will require me to examine you from the side of the bed and then moving into a hands-on examination of your hands, neck and chest, if that's alright with you?
That's fine.
Cool. Are you comfortable in this position at the moment?
Yes.
So we've just got our patient in a 45-degree angle at the moment, which is most comfortable for them. And I just need to ask, are you in any pain at all?
No.
Cool. Would you be able to just open up your top for me to examine your chest?
Sure.
Thank you very much. So first off, we're doing some general observations of our patient. We're checking if Caitlin is obviously short of breath. You'll be able to see this due to the flaring of the nostrils, her increase of work of breathing, if she is able to speak in full sentences. We'll also be assessing the environment for any bedside aids, general medications or adjuncts around. We'll be having a look for things such as oxygen tanks, oxygen tubings, any inhalers or medication, anything really that will give us an indication into our patient's general well-being. I'm going to be looking for any indications of a cough, wheeze or any cachexia. So now I'm just examining the chest for any noticeable scars, any bruising, lacerations, any discoloration. We're looking for any cyanosis at all, also any irregularities of the chest walls, any distension and any masses at all. So while observing Caitlin, I have been able to get a rest rate of 16 breaths per minute, which is within the normal range. Now we're going to do a hand examination. So I'm first going to check Caitlin's pulse. I'm going to check the rate, regularity and the strength. So we're going to time it for a minute. Okay, so Caitlin's pulse is at 80 beats per minute, which is perfect range for an adult. Next, I'm going to just feel the temperature of her hands. So a low temperature may indicate poor perfusion and peripheral vasoconstriction. I'm also going to ask Caitlin now to just take a deep breath in for me. Beautiful, thank you. So this is just assessing the pulsus paradoxus. We're also going to just have a little look at Caitlin's hands here. I'm just looking for any staining due to tar, which may indicate smoking, which will increase the risk of COPD and lung cancer. We're also looking at the peripheral perfusion, and I'm now going to check just for clubbing, which will indicate lack of O2 in the blood. So what we're going to do is just put your two fingers together. Yep, cool. So there you can see diamond window, which indicates that there is no clubbing of her nails at the moment. We are going to now get Caitlin to hold her hands out straight like this. So this is just indicating the fine tremor. A fine tremor will indicate the side effects of beta-2 agonistics use. The flapping tremor, this is called, this will indicate whether the patient is a CO2 retentor or if they have type 2 respiratory failure. Next we're going to assess Caitlin's head. Now first off, I'm just going to assess your eyes. So can you just, with two fingers, just pull down your eyelids for me? So we're just checking the colour underneath to see if anemia is present at all, and it's not. Cool, you can stop that now, thank you. I'm going to get Caitlin to open her mouth for me. Please open your mouth. I'm checking for central cyanosis, and then can you please raise your tongue to the roof of your mouth, also checking for central cyanosis. Now we are going to assess the neck. So can I please get you, Caitlin, just to turn and face me to your head just above the wall. Thank you. So we're now assessing jugular vein distension. We're also going to take the carotid pulse just checking for regularity, strength and rate again, and that is fine. Caitlin, do you have any stomach pain at all?
No.
Cool. Would you mind if I just press on your stomach a little bit just to assess your jugular veins?
Sure.
Cool. So we're just going to put slight pressure on the liver to check hepatojugular reflex. So I'm just pressing in there. Cool. That is all normal. We're also checking for any jugular vein distension. Now we're going to assess the trachea positioning. So this may be a bit uncomfortable for your patient, so you just need to ask for consent and let them know. So Caitlin, this trachea positioning placement, just like assessment, will be a bit uncomfortable for a few minutes, just to let you know. Is that fine?
Yeah, that's fine.
Cool. So I just need you to relax your head back for me. So first off, we're going to measure trachea to see if it is deviated at all. So we're going to do this by placing our index finger on the thorax just beside the trachea and apply slight pressure. And then we're going to also do that on the other side, and then we're going to compare, which is great. Next, we are going to also measure the cricosternal distance. So we're going to do this from the suprasternal notch over here, and then we are going to go all the way up to the cricocartilage. Usually you can get about 3 to 4 fingers, which I can get 3 fingers for Caitlin here, and then we do it also on the other side. And then measuring for asymmetry. And that is all good too. Okay, cool. Now we're going to assess the chest and back further. So again, I'm just looking for any scars, any noticeable discoloration of the skin or chest rise, if it's symmetrical, or if any asymmetry is present. If asymmetry is present, this may indicate a pneumothorax. So also, just after our visual inspection, I'm going to now do a chest expansion test with my hands. So Caitlin, I'm just going to place my hands on your chest, and I need you to take some deep breaths for me through your mouth only. Cool. So I'm just going to place here. Can you do a deep breath in for me? And out. Great. Another deep breath. Great. One more for me, please. Cool. So they are both rising both sides symmetrically, which is great. So now we're just going to perform percussion on Caitlin's chest here. So we're just going to use percussion to measure the resonance of Caitlin's chest. So our dullness will measure an increase in tissue density, where hyperresonance will indicate a decrease in tissue density. So for the purpose of this examination, we've done it over our clothes, but in a real examination, you would want to do it just on the skin. Next, we are going to auscultate the chest. We're going to assess the quality, rate, and the volume of her breaths. So Caitlin, I'm just going to get you to breathe in and out for me through your mouth again, if that's all right.
Mm-hmm.
Breathe in. Cool. So with the auscultation, we're just assessing for any reduced volume, which may suggest reduced air entry. We're also looking for things such as a wheeze, stridor, any crackles or any abnormalities between each side of the chest and lungs that may indicate any abnormalities at all. Next, we're going to do a vocal resonance test, which will indicate also tissue densities or variations. So Caitlin, just when I have the stethoscope here touch your chest, would you be able to say the numbers 99, please?
Sure.
Thank you.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Cool. So any increased volume over an area may suggest increased tissue density, fluid or consolidation, or any lesions such as a tumour. Now I'm just going to do a quick palpation of Caitlin's lymph nodes. So can I just get you to sit up for me? So I'm just assessing her anterior and posterior lymph nodes here. I'm just checking for any abnormalities at all in her supraclavicular and axillary nodes. So any abnormalities of the lymph nodes may indicate infection of the amalgamated pathology like tuberculosis. Okay, finally we're just going to assess Caitlin's back. I'm going to percuss again and auscultate just like her chest. So just looking for dullness or hyperresonance again. I'll just get you to breathe in for me. And again. And again. And again. Again. And again. And again. Again. And again. One last time. Cool, thank you. Now we're going to again vocally auscultate using the vocal resonance test, and I'll just get you to say 99 when my stethoscope touches your back again. Thanks, Caitlin.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Beautiful. Okay, so now this just concludes our respiratory exam for today. So at this point we would summarise our finding, check her O2 saturation levels, we would give her oxygen if indicated, we would get a chest x-ray done if indicated, or take an arterial blood gas reading if indicated also, and then if any cardiovascular issues were indicated or of concern, we would also do a cardiovascular exam.